All right, so for diabetes mellitus, we've spoken about diabetes mellitus, and we've got to establish the fact that some disease conditions is not only about drugs. Sometimes the patient also have a role to play, and that role is what is known as what? Lifestyle modification. So diet therapy is kind of like a lifestyle modification, okay? So in diabetes mellitus, if a patient has diabetes mellitus, there are some foods that they should not be taking. That's what we are after. So we get to look at this dietary therapy, and okay, there are some foods that should not be taken. There are some foods that they should be taking. You get. So look at the diet therapy and the lifestyle modification for patients with diabetes mellitus. All right. So for the lifestyle modification, you need to be doing regular exercise like brisk walking, cycling, and swimming at least 3 times a week. You need to be eating healthy diet. You need to reduce alcohol consumption. When we're talking about healthy diets, we're talking about things like your diet should be more of like fruits, vegetables, and all that. Then if you are smoking, you need to quit smoking. You need to stop smoking. All right. So let's focus on the diet now. Okay, avoid refined sugars and sugary drinks. Why? Because they have a lot of glucose and you're having problems with insulin breaking down glucose. So you don't want to add too much glucose. You get? Then complex carbohydrates should be 45 to what? 60% of your diet. Fats should be less than 35% of your diet. Okay? Then omega-6 polyunsaturated should be like 10%. Omega-3 polyunsaturated should be like 1 portion with oily fish. Then monosaturated should be like 10 to 20%, all right? Saturated fat should be like less than 10%, all right? Then proteins. Proteins should contain about what? Should consist about 10 to 15% of your total diet. Okay? Then eat plenty of vegetables. Then one thing that I added for you guys again, fruits. Eat plenty of fruit. Okay? So that's it for diet therapy and lifestyle modification for diabetic patients.